Recurrent stroke in young age is common in survivors of childhood cancer. A new study from the University of California, San Francisco Pediatric Brain Center shows that survivors of childhood cancer have a high risk of suffering a stroke at a surprisingly young age and also chance for recurrent strokes. More children are surviving cancer because of life-saving interventions. Now, we are facing long-term problems associated with these interventions. The study found that the main cause of stroke were cranial radiation therapy, hypertension, and older age. The findings provide strong evidence for adjusting secondary stroke prevention strategies in these patients, and to aggressively detect and treat modifiable stroke risk factors, such as hypertension. The researchers analyzed data from the Childhood Cancer Survivor Study, which has followed 14,358 survivors diagnosed between 1970 and 1986 in the United States and Canada to track long-term outcomes of cancer treatment. All of the recruits were diagnosed with cancer before age 21. The rate of recurrent stroke within the first 10 years after an initial stroke was 21%, which is double the rate of the general population of stroke survivors. The rate was even higher, 33% for patients who had received cranial radiation therapy. Radiation therapy targeting the head is a strong predictor of a first stroke. Children treated for brain tumors are 30 times more likely to suffer a stroke compared to their siblings. The scientists think high-dose radiation causes the blood vessels to constrict and encourage blockage. If they have one stroke, it's not actually surprising that they have a high risk of getting another stroke. Use of aspirin after the first stroke can reduce blood clots, but the diseased blood vessels due to radiation persist. Current survivor screening guidelines do not recommend checking for diseased blood vessels, even though the signs are visible in standard MRIs. The findings have significant implications for medical follow-up in childhood cancer patients. Based on the findings, University of California, San Francisco has updated protocols for monitoring patients to include screening for both blood vessel injury and modifiable stroke risk factors. Heather Fullerton, MD, Professor of Neurology, founder of the UCSF Pediatric Stroke and Cerebrovascular Disease Center and first author of the study. Sabine Mueller, MD, PhD, Director of the UCSF Pediatric Brain Tumor Center in UCSF Benioff Children's Hospital San Francisco and co-author of the study. Findings appear in the August 26, 2015, online issue of Neurology, the medical journal of the American Academy of Neurology. If we can identify high-risk patients, we can recommend them to be followed by a pediatric stroke specialist. That will be huge in providing effective follow-up care for these children. Thank you.